Hello everyone, I'm Dr. Monica. Today we will learn the difference between primary and permanent dentition. Let's break it down into three key aspects, that is general, morphologic and histologic difference. Let's begin with general difference. So the most basic difference is the number of teeth. Primary or deciduous dentition consists of 20 teeth and permanent dentition consists of 32 teeth. Next difference is types of teeth. In primary dentition, we have 8 incisors, 4 canines, 8 molars. Premolars are not present in primary dentition. In permanent dentition, we have 8 incisor, 4 canine, 8 premolar, and 12 molar. Next difference is duration of dentition. Primary teeth starts appearing in the oral cavity around 6 months of age and last until 6 years before they start shedding, whereas the permanent dentition they start appearing in the oral cavity around 12 years of age. Let's talk about the eruption period. Primary teeth they start erupting around 6 months till 2.5 to 3 years of age, whereas permanent teeth erupts around 6 years till 12 to 13 years of age, except for third molars, which erupts late or they can stay impacted in many cases. Next difference is physiologic resorption, which is unique feature of primary teeth, as the roots break down naturally, which is completely absent in permanent dentition. Now let's explore the morphologic difference between deciduous and permanent dentition. First difference in terms of size. Primary teeth are smaller in overall dimension compared to permanent dentition, which are larger in dimension. Next difference is color. Primary teeth are lighter in color. They appear bluish white or milky white due to the presence of thinner enamel, whereas permanent dentition are darker in color, appear yellowish or white or grayish white due to thicker enamel. Next difference is shape. Primary anterior they appear cup shaped and posterior square shaped, whereas the permanent anterior appears square shaped and trapezoidal shape is seen in permanent posteriors. Talking about the cervical constriction, in primary dentition, the crown is more constricted in the cervical area, but in permanent dentition, we can see that there is less constricted at the cervical portion of the crown. In deciduous teeth, the cervical ridges they are more pronounced, especially on the buccal aspect as we can see in the diagram. But in the permanent dentition, we can see that the cervical ridges they are much more flatter and less noticeable. In primary dentition, the occlusal table it is narrower, but in permanent dentition we have broader or wider occlusal table, providing the necessary surface area for more complex chewing as compared to the children. Talking about mamelons, primary incisors don't have mamelons. Their edges are smooth, whereas the permanent incisors, when they first erupt, they do show mamelons. These features eventually wear down as the tooth matures. Talking about the next characteristic is supplemental grooves, which are found more in the primary dentition as compared to the permanent dentition. Now talking about the roots, primary dentition, they have longer and more slender roots compared to the crown size and are narrower mesodistally, whereas in the permanent dentition, it presents with bulkier and shorter root in comparison to the crown size, and the roots are broader mesodistally. Next difference in terms of furcation. In primary molars, as we can see in the diagram, the furcation of root is placed much more cervically, so that the root trunk is much more smaller. But in the permanent dentition, the furcation is placed much more apically, so we can see that the root trunk appears larger or it can be a broad root trunk. Pulp chamber in the primary dentition it is larger as compared to the crown size, but in the permanent dentition it is smaller as compared to the crown size. Next is the pulpal outline. In the primary dentition, we can see that the pulpal outline it follows the dentino-enamel junction more closely as compared to the permanent dentition. Coming to the next difference, that is the pulp horn. Pulp horn it is relatively higher and closer to the outer surface in the primary molars as compared to the permanent molars. Root canals in primary dentition is more ribbon-like. It follows a thin, tortuous and branching path, whereas in the permanent dentition, it is well defined with less branching. Talking about the accessory canals in the pulp chamber, in the primary dentition, it is more and directly it leads to the interradicular furcation areas, whereas in the permanent dentition, we cannot see accessory canals. Next is the apical portion of the canal, which is less constricted in the primary dentition as compared to the permanent dentition. Next comes the apical foramen, which is wider in the primary dentition as compared to the permanent dentition, which shows a narrower apical foramen. Now let's explore the histologic difference between primary and permanent dentition. The first difference in terms of enamel, which is thinner and about 1 mm thick but of uniform thickness in the primary dentition, whereas it is 2 to 3 mm thick and is not uniform in thickness in the permanent dentition. Next, we have the enamel rods, which are directed horizontally at cervical third in the primary dentition, but in permanent dentition the rods are directed gingivally or apically at the cervical third. The next difference in terms of dentine thickness. The dentine thickness is half in the primary dentition in comparison to the permanent dentition. Next comes the dentinal tubules, which are less regular in the primary dentition as compared to the permanent dentition. Talking about cementum, in primary dentition it is thin and made up of only primary cementum, whereas in the permanent dentition it is thick and made up of both primary and secondary cementum. Next comes the blood supply. Blood supply is abundant in the primary dentition due to the presence of wide enlarged apical foramen, whereas it is reduced in constricted foramen of permanent dentition. Talking about innervation, primary dentition, they are less densely innervated as compared to the permanent dentition. In terms of anchorage, primary dentition are comparatively less firm and roots get resolved, making them easy to extract. But roots of permanent dentition, they are firmly anchored in the alveolar bone and they are not easily resolved. Talking about the mineral content, both enamel and dentine are less mineralized and less dense in the primary dentition, but in permanent dentition, mineralization is more in both enamel and dentine. Coming to the last difference in terms of neonatal line, which are present in all primary teeth, both in enamel and dentine, whereas in permanent dentition, it is seen only in the first molar. Please like and subscribe this channel.